Guys, how's it going? It's Ashley. So it is Sunday, December the 21st. I'm 5 days post-op. I had my surgery on Tuesday the 16th. Sorry I haven't posted much, but I've had a little bit more difficult of a time than I originally had expected. I've had to take a lot more pain medication, so I've been really woozy, and they had to increase the pain medication that I was taking, which made me cross-eyed, so there was no hope of me making any kind of a video until I was a little bit more clear-headed. And please excuse the dogs. They insist on being in my lap as much as they can. They're my protectors through all of this. So the surgery was on Tuesday. I had the patella realignment surgery where they had to, in a sense, break my tibia bone and move my kneecap and reposition it with screws and that kind of thing. I requested, before the surgery, when the anesthesiologist came in to talk to me, I requested a femoral nerve block. And they did that. That wasn't nearly as bad as I expected it to be, and I was hoping that it would help with a lot of the post-op pain. But when I came out of surgery, they had a really, really hard time controlling my pain. They were afraid that they were going to have to keep me overnight. I did not have to stay, thankfully, but they maxed me out on every kind of pain medication they could give me while I was still in the post-op recovery. We didn't get home. Surgery was at 10. We didn't get home until almost 8 o'clock that evening, so it was a very long day. Not necessarily for me, but for my boyfriend and my aunt who went with me. I don't remember much about the ride home. I know I was nauseous and just did not feel good. We got home, got settled down. Later that evening, I did end up getting sick from the anesthesia. But I was also prescribed Zofran, which I had been taking, or have been taking some, because the pain medication also makes me nauseous. They prescribed Percocets, and I've never taken Percocets before. They give me a really odd ringing in my ears. Like I said, it makes me cross-eyed. I had all intentions of just vegging on the couch and reading a ton of books, but it's all I could do to just read a text message. My eyes have been so crossed. It's been horrible. This is Whiskey. Hello, Whiskey. So the day after, the last 5 days have really just been a bit of a blur. Probably from the anesthesia, probably from the medication, but I don't remember everything. I know I've had really good days, and I know I've had some really bad days. I know that Wednesday, the day after, was not that bad. Actually, Chris and I invited some friends to come over, and they hung out with us for a couple of hours that evening. The femoral nerve block was still helping with the pain, so the pain wasn't terrible, but I was still loopy from the medication. Thursday's kind of a blur. Don't remember a whole lot. Friday, Saturday, I guess most of the week's been a blur. Yesterday was a pretty rough day. I woke up crying. I went to bed crying. Just emotional. Everything is so much more complicated and difficult than I expected it to be. Getting around, I'm okay with the crutches and moving around, but getting a shower, Chris has to help me in and out of the shower. My whole leg is really uncomfortable. It hurts to engage my quads, so lifting and moving my leg on my own is really difficult. So he has to help me with that. I can go to the toilet by myself, but showering is quite a feat, and that's Diesel. Hello, Diesel. I am in a long leg brace. I'm not icing currently. It has been iced for the last 5 days. We're giving it a break. There is an ACE bandage type wrap on, And then underneath that, there's some other bandages. It is about a 6 to 8 inch incision from above my kneecap to my shin. On top of the stitches, there are some steri-strips. I'm not messing with any of that. I have kept it covered when I get in the shower so as to not get it wet. And we've done really good. I'll show you some of the stuff that I've used to make sure that it stays dry. So that's about it. I'll throw in some pictures of the incision and the bruising. I've had quite a bit of significant bruising. My shin's bruised and my poor ankle is so swollen, and the bruising has gone down into the inside of my ankle. So it's uncomfortable, but I'm making it. Today's probably been the best day so far. I'm not dizzy. I'm not cross-eyed. I'm not confused. I'm pretty coherent. And this morning was a little rough, but I think that's going to be normal over the next week or so. But as far as pain's gone, it's not been really terrible. I use my phone. I set an alarm. Chris has done really well with it too. We set an alarm for when it's time to take the medication. So I stay on a pretty strict schedule so that I don't run out. That's been helpful. Very, very helpful. When I first started the pain medication, I was trying not to take too much. So we were doing every 4 hours, but I noticed that it was wearing off with about an hour left to go. And the doctor had told me not to let it start hurting, to, take some medication before it started hurting. It's easier to prevent than it is to stop for the medication to work. So we stayed on the schedule. There were 2 days that we were doing 2 every 4 hours, and that was the days that I don't remember much. But now I'm back down to 1 every 4 hours, and that's doing really well. I'm probably going to start increasing it to 5 and 6 hours over the next couple of days to start kind of weaning off some. So that's my update so far. I'll do a couple more videos over the next couple of days now that I'm of a sound mind, and I'll let you guys know what I'm doing to keep the incision dry and how I'm getting around the house. And I'm going to do a review of my really awesome crutches, because I'm not using just your normal drugstore brand crutches. So I've got a couple of other videos planned, and then of course we're going to get through the holidays, and I'll probably do a few more. So thanks for watching. If you have any questions, feel free to ask, like, subscribe, and there'll be more to come. See you soon.